When it comes to health and medicine, women have historically faced underrepresentation in research, undertreated, and often misdiagnosed. In addition to being overlooked in terms of accessibility and convenience to comprehensive healthcare needs focused on their unique needs.
When we talk about how we're going to address the historical underrepresentation of women in healthcare, we talk about access, brick and mortar spaces in the community. We talk about outreach, where we are proactively bringing women to us and helping them in an authentic way that means something to that individual woman. And we are focused on competent care that is compassionate.
Women often feel like they're being dismissed or they're not being heard. They may be called hysterical when they actually do have a severe medical condition. And over time, these women may no longer present for medical care because of how they've been treated. My approach is really to practice patient-centered care, which means that we take our time and we listen to what they have to say. It's really our responsibility to sit down with them and to really understand why they presented. Maternal health care has been an area of focus. The CDC did recently report some statistics that are concerning, especially the disproportionately higher number of maternal deaths in Black women compared to white women. There have been focus on some of the leading causes of maternal mortality, such as hemorrhage and infection, as well as high blood pressure or hypertension. There have been new devices that have been created for blood loss, as well as national protocols for high blood pressure. The focus, again, has been in treating women in the hospital. There is a large push to treat women in the postpartum period. About half of maternal deaths are after delivery. We want to make sure that we provide them the care that they need after they deliver. In the hospital, that means that we want to make sure that they know when to follow up, what to look out for, some warning signs and symptoms to call their doctor or to come back to the hospital, and then also help them facilitate appointments.
A community hospital not only provides consistent care, but also generates positive economic impact by offering fulfilling medical careers opportunities to individuals in the area.
The vast majority of our team members live and work here in the community. Whether you start here at an entry-level role, or you become a physician, or you become a registered nurse at the local community college, each one of those roles bring with it a great job with a good salary and also healthcare insurance. We can be an economic engine for this community.
Every local community deserves a local hospital that offers healthcare, employment opportunities, and ensures women receive the essential care they need. Peconic Bay Medical Center has been a cornerstone of healthcare excellence in our community for more than 70 years. PBMC has been focused on bringing a full range of women's health services to the East End that the community not only needs, but deserves.
I was 36 weeks pregnant with my son. I felt this gush, almost like my water had broken, and when I looked, it was a surge of blood that just wouldn't stop. My husband, who I immediately called afterwards, called an ambulance, and they brought me here to PBMC. I knew I wasn't in labor, but something wasn't right. My instinct was telling me not to just get myself to the other hospital and really treat it as an emergency. The team that was waiting for me was incredible. It was almost like a scene out of a movie. I had all the nurses and technicians and the doctor. Between the time of me noticing the blood to the time that I delivered my son, it was under 50 minutes. So it was a very quick experience. I then went to the OR and Dr. Quesada delivered my son. He had mentioned to me that had I gone to the other hospital I was supposed to go to, or had I just not gotten into an ambulance or not really advocated for myself to take this as an emergency, 100% my son wouldn't have survived. That's a testament to the team here at Peconic.
My goal with every patient encounter is to make the woman feel safe and make it an environment where they feel that they can speak openly. I really do want to empower them to use their voice, because this is the one time where they came because they felt like they needed emergency care. If they need to see a specialist, we want to make sure that they are aware of that and then provide them either with a phone number or try to help facilitate that appointment. In our community, there is a large number of Hispanic and Black women, and we want to make sure that they don't feel like they have to travel over an hour away to receive the care that they need or that their babies need. Peconic Bay Medical Center is committed to the women in our community, as well as fighting this disparity, especially through the Women's and Infant Center.
Peconic Bay Medical Center is the community hospital, and we want to keep our community members in need close to home, built by them and serving them.
We still see women coming to our emergency department in labor, having not had prenatal care. That is completely unacceptable. And we see that as part of our responsibility to ensure that women are being taken care of in which should be the most joyous time of their life. And for some, it's the most stressful part of their life. It is our responsibility to look at each individual in the eye and say, how can we help you make this journey what you want it to be? What matters most to you? And how do we help? We are powered by knowledge through the Katz Institute for Women. We know what's going on in the national statistics, but we take it to the individual, one person at a time. And I think that's what a community hospital spirit does for a community. Until we have a community of people who live to 100 and are still active and living their best life, we're not there yet. So we have plenty of work to do, and we will keep at it.
To find out more, visit pbmchealth.org.